I'm at NIH. I have a laboratory that looks at biomarkers that relate to traumatic brain injury, as well as concussion and blast exposure. A lot of the work that I do is in collaboration with many of the people here today. I oversee the biomarker core for the CNRM, as well as work with Kim Kenny on the Sensi, who's on her phone. Sorry. She's even listening to a voicemail. Anyway, so Sensi as well as NCA Care Consortium, also working with West Point, DHA, and basically anybody who wants to do biomarkers wants to do them in a fundamental way. We're partners, and we look to doing collaborative science in the best way we can, because I think that's the best way to really address this complex issue. Everybody's talked about this today. It seems like a small injury, but everybody experiences it differently. And so really the focus of our biomarker studies is to understand the nature of that individual variability. So why do some people recover, whereas others do not? We know that every TBI is not the same type of injury. Every individual is not the same individual. So how can we use biomarkers to really personalize the care that we provide, and also to select those patients that most often need that care? And so that's really the focus of what we do, to understand the mechanisms that underlie the development of chronic symptoms and deficits, as well as to personalize the care that we can provide, especially in the acute or early time periods. So that's kind of what we do with our group, and also kind of how we've applied this looking at the biomarker development. So specifically, I look at biofluid-related biomarkers, but within the biomarker development core, we're also looking at neuroimaging as well as neuropsychological functioning, and to really understand how to bring all of those together, because I think that's where it really becomes exciting with science. We can combine these different modalities to better understand these issues in a more comprehensive way. And so it's really exciting to be here today and to be able to be part of this type of event and also this initiative moving forward. So overall, I actually think those are the wrong slides that are up. Oh, you fixed it. Okay, so I can't see my own slides, but I can see. So basically, I should know this by heart, but the focus of our group was to look to see how we can use biomarkers to improve the care that we provide to individuals who have TBIs, and really the focus of how we can optimize those and integrate this type of science. And so what we're looking for is, of course, this ideal biomarker. We know that this is not tenable now, but hopefully in this type of environment, we have the ability to do this through these collaborations and this funding and this initiative moving forward. So when we think about biomarkers, we think about them in a couple different ways, looking at all the different types, including neuroimaging, biofluids. But how can we identify biomarkers that are sensitive, that allow us to identify those individuals who've had a brain injury from those individuals who don't? This is important, essentially, when we think about combat stations, when an individual may have other types of physical injuries, and the brain injury may be missed. So how can we distinguish them in that acute time period to be able to provide preventative interventions? We're also looking at things that are specific, that really allow us to have the specificity to say, we don't need to follow you over time. You can go home and recover. We're not worried about you. That's an intervention within itself. Whereas we can focus more closely on those individuals who will not have an optimal outcome and something that's prognostic. So biomarkers that allow us to identify those patients or individuals early who will have those non-optimal outcomes. So that way we can provide preventative, targeted interventions. We also want to find things that are safe, especially when we're thinking about neuroimaging, as well as translatable to large consortiums, as well as thinking about the patient care, where people come into care in emergency rooms, on sports fields, as well as during deployment stations. How can we optimize these to be used? And a lot of the talk that we've had is how do we combine neuroimaging with biofluid-based biomarkers to really understand how they can be integrated and then optimized to make these very difficult point-of-care decisions. We're also looking for things that are reproducible. So as we go on, to be able to make sure that the finding is consistent. Again, there's going to be a high degree of individual variability, but we also want to find biomarkers that translate, that we can use in clinical practice to optimize those individuals that we need to follow, as well as to find biomarkers that give us an identification of the mechanisms that underlie the onset of these deficits and symptoms. I think David brought up something really important today, and that's symptoms, and we can't tackle everything with one biomarker, but there are going to be biomarkers that are different for different types of symptom presentation. So specifically, there may be biomarkers that predict headache, whereas other biomarkers may predict mood disorders. And so really parsing that out to be able to look at those different biomarkers and not just put them into one big bag and say, this is the biomarker of TBI, but really looking at them more over time and to really understand their dynamics and how we can use those and optimize those. And specifically, a lot of the work that we're doing within our Center for CNRM is how can we identify those biomarkers early to then use those to also monitor patients and to see how they respond to treatment. And this really is the focus of how we can personalize the care that we provide to these individuals. I think it's really important when we get a patient coming in, especially early, there's a time where we can optimize the care that we provide to prevent the long-term deficits and symptoms. And it's really a window of opportunity before those neurological deficits occur. And so it's important to optimize as much as possible in that acute time period. But also more recently, we've been doing studies and moving forward to understand biomarkers more in the subacute period as well as the chronic period. This becomes a much more difficult endeavor because a lot of comorbidities also come into play. So we're looking at veterans who often have 4 or more comorbidities coming into studies like Sensi. And how do we do biomarker studies to understand the mechanisms of one or how they are shared between these different vulnerabilities? Really to have the focus, again, how we can optimize the care we provide to these individuals. And so some of our top takeaways is first that it's really exciting to finally have kind of traction in the field and have biomarkers specifically of TBI, and specifically having the finding that's been mentioned before of UCHL1 and GFAP as identifying those patients who have a CT positive from healthy controls. We've gone on in our group as well as others to further refine this, and so it's really promising to see these serum biomarkers be things that we can find in the blood and actually relate to these types of injuries as diagnostic biomarkers. We're also looking towards the future of different biomarkers that we can look to see the activity of genes as well as microRNA. These are more prognostic type of biomarkers that give us some insights into the mechanisms that underlie that individual variability or vulnerability for some individuals. We're also finding that neuroimaging biomarkers are promising, especially in the diagnosis, and that by combining them with fluid biomarkers, we're finding promise in more prognostic pathways. We're also finding that there's advances in neuroimaging techniques that can really help us understand where we're going, but more is needed about normative data, which has also been mentioned before, and how do we really understand these differences and how they contribute to long-term outcomes. So some of the gaps that we've seen. First, to understand how these blood-based biomarkers really contribute to pathology. Of course, when we're looking at blood, and especially when we're looking at individuals over time, we're looking at something, I think somebody mentioned that blood also goes through the toes, through the rest of the brain. So how can we use the blood as a proxy to understand central mechanisms? And so a lot of the work that we're doing in our lab, as well across the field, is to look at more central mechanisms using exosomes and other methods to look at monocyte activity, to really use the blood in the most optimal way to understand these central mechanisms, because we're limited, especially in these large cohorts of healthy individuals for the most part, who are aging and going through different processes. We want to get as much biofluids as we can to understand this, and we're not going to be able to get CSF. So how do we optimize the blood in the best way that we can to understand? And technology has really been our friend, allowing us to get better amplification of the signal, as well as greater specificity and sensitivity. And so that's really kind of opening up new avenues for us, so that's an exciting new pathway. We're also looking to validate biomarkers in the subacute and chronic. There's not as much literature here. This is starting to build, but we don't know if it's the same biomarkers in the acute period that then transition to the subacute and chronic, or if they're all different type of biomarkers. And so those are some of the studies that we looked at, but they're definitely not enough to really come to a consortium or come to a consensus about what those mean and translate those into any type of clinical application. We're also looking for markers that identify improvement to drugs being tested. And so this is a promising new avenue to go into, but it hasn't really been determined yet. And we're just now seeing biomarkers really start to be integrated into clinical trials, both to select patients that might have more optimal recovery or are more apt to respond to that specific intervention, as well as to look at biomarker changes over time to see how that actual intervention modified things like tau, as well as other things like GFAP, which we know are biomarkers that are related to neuronal pathology. Lastly, imaging metrics and other objective biomarkers to guide and assess effective rehabilitation or other interventions. Some of this work has started, but it's definitely limited. So we need biomarkers that help us understand how individuals are overcoming these issues, especially symptoms and deficits in this chronic phase. And so it's exciting, and I also extend that everybody should be engaged in the afternoon. I think it's a missed opportunity if we don't take this, to have so many amazing people in the audience to be able to work on such an important issue. So thank you very much.